Hi, my name is Mike Dreyer. I'm married to Jean Dreyer. The most important moments to me in terms of what really shaped the experience. The first one is the diagnosis. That's when everything just falls away. You've got a cell phone which has access to lots of data on the web, and within 3 minutes I was looking it up, and everything was just, it was negative. It was, 1 to 3 year survival rate, uncurable, basically get your affairs in order. Terrifying. That to me is one of the most important moments for any family that has to undergo a cancer diagnosis, is making sure that the right people are delivering the message, making sure that the people that are delivering the message have the information. One of the best moments where, the big weight was lifted is when we met with Jean's doctor, Dr. Munchie, the first time. We're sitting down. He goes, "I want you to know that I don't consider this a death sentence, I consider multiple myeloma to be almost a chronic disease that we can treat." It's what she needed to hear. It's what I needed to hear. And to be honest with you, it set the stage. It really did. If we hadn't had that moment, I don't know how long we would have went. One of the things that caregivers need to do and need to find, especially with multiple myeloma and other, blood type of cancers, is get them somebody to talk to. Encourage that they go talk to somebody. It's critical that they have that person, because it gives them a chance to tell somebody else their worst fears. Things that they're not going to talk to their spouse or, their significant other with. Somebody to talk about their real fears. One of the bigger challenges with the medical industry is they don't spend enough time learning what's important to the person. One of the things that I've appreciated, and we were very fortunate with our physician, Dr. Munchie, is he realized that she was an active person. And so when the critical moment came after her stem cell transplant and she wanted to get outside and start running, most common medical opinions at that time was, no, you're not going to do anything for 6 months. For him, he was like, make sure that you're, in control, and go for a run and go and do that. So I think part of helping patients to thrive is understanding what's important for them. There are a lot of times where you are just a number going through the system. And sometimes you need somebody to put everything into perspective for you. There was a time when I had a list of 30 medications, and Jean was having bad side effects to some of them. You just don't know where to go or what to do. You want to have somebody that has the whole picture. And I think it's crucial that, in order to have a successful outcome, somebody that has visibility to the entire picture, that can communicate with all the parties involved, and that can understand the patient as the person that they are, so that they can best make recommendations for an improved medical process. We've had a couple of events that have occurred over the course of her diagnosis and treatment where we were empowered and it made a difference. We had people in our lives that are familiar with the medical system. We have people in our lives that were able to point us in the right direction. But we've also talked to a lot of people that don't. And we've talked to a lot of people that went down the road 2 years after diagnosis without really knowing what their options were, how things could be improved for them, wondering how we had such a good quality of life and they didn't, wondering how we were getting certain treatments and they didn't get a chance to have. And so, from that perspective, again, having that type of advocacy, having that type of coordination, and on top of that, having the knowledge behind that coordination would be extremely beneficial. One of the key elements that should be, focused on as a way to improving the overall care process is trying to localize the care a little bit more. And what I mean by that is having a core center of knowledge, such as Dana-Farber, but being able to get treated locally, being able to have transfusions, blood tests, be done locally, because really what it brings is a quality of life to the patient, because they're not constantly commuting back and forth from a location. The other thing is the overall coordination of efforts. One of the positive experiences that we did have where I felt that this had the largest impact is when we had our stem cell transplant. When we arrived and we were ready to talk about the stem cell transplant, they handed us a manual. They gave us 2 or 3 nurses that we could speak to in addition to a physician, where we went through every part of the process, everything that's required. Everything was in this manual that was handed to us. The entire process was phenomenal. And to be able to have that type of care and attention to all the other elements of the cancer treatment process would be great, because it gives the people the chance that need to do the research to do the research. It gives the people the chance that need to have questions answered, have them answered. It also helps bring everybody together that's involved in the process and make sure that they're a tighter, more cohesive unit, for the patient.